Maureen, are we about ready, or?
Yep, it's 2 o'clock.
Yeah, it's 2 o'clock.
Heather's going to introduce you.
Now, are we going to have an open discussion also?
Absolutely.
Okay, good, perfect.
All right, so welcome everybody. Nice to have you here today. My name is Heather, I'm Program Manager here at the Must Receive Project, and we have Mr. Bill Drennick here. We're really excited to be hosting him again. Before I give a nice warm welcome to him, I just want to point out a few things. This Saturday, we are doing our official groundbreaking ceremony for the Assisted Living Project. So if you are free and would like to join us, that will be starting at 10:30, official breaking grounds at 11. So we have
I'm getting mixed messages.
mixed messages on timing. So
Yeah.
10:30 is arrival, mingling, 11 is
So it is 11 o'clock.
Yep.
Okay.
Yep, and so we'll have guest speakers, including Edie Morgan, our founder, so if you're able to come, that would be wonderful. There's also a flyer explaining programs that we have going on right now, and then there's some free emergency gift bags down here, so.
So just for information, the latest announcement that went out to the Keep Melissa Facebook page, the time indicated on that send out was 2 o'clock.
Oh, interesting. Okay, well,
So you might want to check and make sure.
okay, thank you, Neil.
That's fine. Mixed messages.
Okay, sounds good. But yeah, so there's lots of handouts over here, including the groundbreaking ceremony. So anyhow, the reason why you're here, we have Bill Drennick. He's a licensed sales representative with Washington Senior Resources, LLC, and he's here to offer unbiased presentation on Medicare and Medicaid and this open enrollment period. So thank you so much for being here.
Okay. Well, thanks for coming today, everybody. Again, my name is Bill Drennick. I'm owner of Washington Senior Resources. I'm a former high school teacher, so I am more of an educator than I'm a salesperson. I don't like selling things, but I love educating people, and that's why I love this profession I have. It's kind of my passion in life right now, helping people. And Medicare is very, very confusing. There's a lot of moving parts. Everybody's a little bit different. Everybody has a different situation. They have different medications, different doctors, different needs for benefits, those types of things. So anytime during the presentation, feel free to ask a question. I may ask you to take your mask up a little bit just to talk. Sometimes it's hard to hear, and then put it back up. So we'll start with this. Education is the key to making good healthcare decisions. That's my motto. You need to be educated to know what, in order to make a good decision. You have to understand your situation, and the best way to do that is to ask questions. So our goal as educators, teachers, was to make sure students had a curriculum that exposed them to basic courses. Obviously, once the students have knowledge of the basics, they can now pursue their interests. Should they desire to be proficient, they must continue to take their education to a higher level. Educating people on Medicare is a very simple process. I educate people on the basics of Medicare so they have a clear understanding of how it works. The educational process by explaining why only certain plans will meet someone's healthcare and financial needs, and then comparing those plans that do fit their needs. They now have the knowledge and confidence to make their Medicare plan decisions. The only difference is that I do the research. My clients do not need to do that. Medicare is very complicated and does not stop at enrollment. I am a resource throughout the year for my clients. So if my clients ever have an issue with a bill, they get a bill they weren't supposed to get, or they have a question about the benefits on their plan, I want them calling me. I don't want them calling customer service. Call me first. Most of the time we can resolve that issue without them having to go through customer service, because sometimes it's not a very pleasant experience and you can get kind of pushed around a little bit. So the thing is with my clients, bottom line is I want them to be confident in the plan that they choose. I educate them on the differences, the comparisons of their plans. So basically what you do is there's over 50 Medicare plans in Pierce County. Well, where do you start? Well, what you want to do is to narrow those plans down to where all your medications are covered and all your doctors accept. And then we can do a compare, okay, here are the plans that work well for you, and then we can discuss and go into the details of different types of benefits, dental, hearing, naturopathy, chiropractic, gym membership, all that other part will maybe determine what plan is best for your needs. The most important thing is you be confident that you're in the best plan for your needs for the year. Okay, so how do you sign up for Medicare? Talking about this, Social Security. Enrollment in Medicare is supposed to be automatic at 65. However, when you do apply, you want to make sure you're applying for Part A and Part B. In the past, you were always entitled to 65 to have Part A. I don't know right now. Neil, maybe you can help me out with this. For some reason, some people are not actually enrolled in the Part A until they do it themselves. And so your card arrives in the mail about 3 or 4 months before your 65th birthday. Well, that isn't always the case. You can actually apply for Part A and Part B through Social Security 3 months before your birthday month, the month of your birthday, and 3 months after that. So how do you sign up? If you're not collecting Social Security, then you have to go to Social Security or go to Medicare.gov or also SSA.gov to enroll into Medicare Part A and Part B. This is what your Medicare card looks like. So, when people enroll into Part A and Part B, they have their Medicare card. They have no prescription drug coverage. They don't have other benefits. There's a lot of benefits that Medicare does not cover that are covered on Medicare Advantage plans, and we'll get into that a little bit later. But this is what your card is going to look like. So, with this, you're going to have some deductibles and copays, and we'll get into that. Here's the enrollment period. The initial enrollment period is when you're turning 65, 3 months before, the month of, and the 3 months after you can enroll. We mentioned that. We are right now what we call annual enrollment from October 15th through December the 7th. That's the one time during the year that people can make a plan change for the upcoming year. Most people. There's a special enrollment period here. Is in the middle of the year you might want to retire and go on to Medicare. Well, you're not from October 15th to December the 7th does not apply to you. You have a special enrollment period so that you can enroll into a Medicare plan in the middle of the year, transitioning off your employer coverage into Medicare. And there's one more opportunity from January 1st through March 31st to have another opportunity to make a plan change. If you miss this enrollment period here, you have one more. In the past, Medicare did not offer this. It's just been about 2 years. And why did they do this? I think the reason was that they implemented this is because not enough people were reviewing their plans during annual enrollment. And they go to the pharmacy in January, pick up their medications, they found out one of their medications isn't covered. Well, medications can be very expensive if you don't have coverage. So I think what Medicare said is we're going to give people one more opportunity to make a plan change if they haven't had their plan reviewed and make a plan change for the upcoming year. Part A is hospitalization, skilled nursing, hospice, and in-home care. That's what's covered on Part A. So you have a deductible of $1,484 per occurrence with standard Medicare. Now we're still talking about Medicare, not Medicare Advantage plans. And so you have the first 60 days is covered 100%. Then after that, you're going to have some costs incurred. Skilled nursing, for the first 20 days, there is no cost for a skilled nursing facility. Skilled nursing facility is where they would admit you after you've been discharged from a hospital. Let's say you had an injury. You were in a car accident, you had some lower body injury, and you needed some rehab. They would actually admit you into a skilled nursing facility for that rehab. Part B, well, we've got 158, I think, is going to be the premium for next year, but right now it's 148.50 is what your premium is for Part B services. Part B covers all medical services. Hospital, Part A is hospital, medical services is Part B. Doctor visits, labs, x-rays, ambulance, emergency room, outpatient surgery, all of that is covered under Part B. Part B does have a $203 deductible, but with Medicare you have an 80-20 split. So you would be paying 20% of the cost of these services. Could be quite costly. So this Part B is $148.50 right now, but if your income level 2 years back is higher than 100, let's say 85,000 or 170,000 as a couple, then you could have some higher copays. I have some clients that are paying $460 a month for their Part B because they made a lot of money 2 years ago. However, if you're coming off employer coverage and you're obviously losing your job, so your income is going to drop, and that is called a life-changing event. You can actually fill out a SSA 44 through Social Security to help them reevaluate and drop your premiums down. That has worked in the past.
So SSA, what do we, for the income when it drops, we contact Social Security?
Well, if you're coming off employer coverage, and you get a letter from Social Security saying that your Part B premium is more than $148.50, that means that they're basing that premium on a higher income. That's when you'll want to contact them.
Only if you were making quite a bit of money and then all of a sudden that went away and now you could reduce it because your income changed so much.
Correct. And what happens sometimes is people have real estate and they sell real estate.
Yeah.
And they go back 2 years. So if you sold real estate 2 years ago, they're going to say, okay, your income was higher then, but then you can say, well, but my income is I've lost my income because I'm not working any longer. They can adjust that. Best thing I tell my clients, if you have any questions, give me a call. I'll walk you through it, exactly how we do it. Okay, so what doesn't Medicare cover? Routine dental, vision, drugs, hearing, long-term care. So there's a lot of benefits that are available on Medicare Advantage plans that aren't available on Medicare. That's why these Medicare plans were put into place back in 1996, I believe, in the Clinton administration, is when these Medicare Advantage plans came into play. Of course, this goes back to the Johnson administration. I think it was 64 is when Medicare was actually established. So when you delay Part B, you're working. A lot of people work past 65. Well, if you are employed by a company that has more than 20 employees, you do not need to enroll into Part B at this time. You can delay that until you're ready to retire. I'll give you an example. About 5 years ago, I had a gentleman call me and he said, my buddy said to give you a call. He goes, I need to get on a Medicare plan. That's why I can help you. What's your situation? He goes, well, I'm retiring from Boeing. I said, okay. Yeah. I said, what do I need to do? And I said, well, you're at 65. I said, you have your Part A, so go ahead and enroll in the Part B. And he says, I did that. I've done that. I said, oh, I just do it recently? He goes, no, I did it when I was 65. And I said, well, how old are you? He said, 67 and a half. And I said, I hate to tell you, but you've been paying your Part B premium for 2.5 years for no reason. And at that time, it was around $108 maybe. So it was about $2,500 or so that he had paid into the system. He didn't have to because he had what we call creditable coverage through Boeing. So he asked me, can I get that back? And I said, well, call Social Security, here's their number, and ask them. I knew what they were gonna say.
No.
He called me back about 45 minutes later after being on hold, and he said, they told me no. And I said, I have to be honest with you, I knew that's what you were gonna say, but I wanted you to hear it. You know, it's kind of important for,
Yeah.
don't take my word for it until check yourself. So, in that case, even if you're on a spouse's employer coverage, you know, you don't have to be employed yourself, but if your spouse is on your plan or you're on your spouse's plan, and still you do not need to enroll in the Part B if that coverage company has more than 20 employees. Why the 20 break off? I don't know. But if you continue to work in a company that has less than 20, there's a good chance you're going to have to pay that Part B premium. So you're going to want to check on that. Yeah, so covered a creditable employer health plan. You have no penalties and no loss of options. Late enrollment penalties. So, Part B penalty is an additional 10% of the Part B premium for every 12-month period that you delay enrollment. In most cases, you will have to pay the penalty every month for as long as you have Part B. Well, that means as long as you're alive and have your Part B. Part B is for medical services. I don't know who would want to be past 65 and not have access to a doctor. You have Part A, you go to the hospital, but what if you have to see a doctor? So you really need to have Part B. So I'm not sure why somebody would not enroll in the Part B right away. Apparently there are. I haven't run across one that has a Part B penalty because, you know, they've enrolled. Now I'm sure there are some people out there that have, and that's probably why they still have the penalty available. No, not planning to retire at age 65. Like I said, you can decline your Part B until you're ready to retire. Medicare Advantage, that's called Part C. So, with Medicare Advantage, what you have is you have Part A, hospital included, Part B, medical services, and in most cases, Part D, prescription drug coverage. They're offered by private companies. They combine your A and B, often include extras such as fitness and wellness, dental, vision, and hearing, and may also include prescription drug coverage. Well, why would somebody want to enroll into a plan that doesn't have prescription drug coverage? Well, if you're a veteran and you have VA benefits, you do not need to. You've got coverage. Veterans is a one category of people that can also have two prescription drug coverage. They can have coverage through the VA and they can have it through his Medicare Advantage plan if you wish. Part C replaces A and B. So what happens is you're on your red, white, blue Medicare card and you want to enroll into a Medicare Advantage plan. And you want to enroll into a zero monthly premium plan, let's say. Well, how's that all work? How can you get onto a zero plan and have all these benefits? Well, what happens is Medicare has a contract with your company you're enrolling into and every Medicare plan, and they will pay that plan so much a month to take on the responsibility of any costs over and above what you're responsible for. So, I don't know what that, I believe that is calculated based on your health history, on what Medicare says we're going to pay you. Let's say $1,000 a month. We'll throw that out, a nice round figure. So now Medicare says, okay, United Healthcare, Premera, Aetna, Humana, whoever it is. Now, you're responsible, we're no longer responsible for that 80%. We're going to let you handle it. You know this medical industry much better than ourselves, keeping people healthy. We'll let you do it. Do you agree? Yes, we agree, we'll take it on. So no, Medicare's out. You still have your Medicare A and B, and you still have to pay your Part B premium, but Medicare is not responsible to pay that 80% any longer. Now it's up to the plans to develop their different plans within their company that meet different needs of people, some with a 0 monthly premium and some with premium plans.
So I have a question.
Yes.
So if you signed up for, the Part C, and you're saying that, they'll cover more, but sometimes they say it's gonna be 0. In other words, the 0 would be, you don't have to pay extra after you've already paid for your A and B. They're saying, we'll let you be on it without paying extra. So basically, are they tapping into, like, your Medicare money you're paying into it every month, so then that company gets to legally tap into that money to help pay, because how else could they do 0? I mean, they tap into that money that you paid for Medicare.
Well, what'll happen in 0 plans, usually people that go to the doctor once or twice a year,
Yeah,
take very little meds,
right,
they'll enroll in a 0 plan. Because why pay the premium?
Right.
I don't go to the doctor that often.
Right.
Now, as you see with Medicare Advantage plans, if you have a 0 monthly premium plan, as opposed to, let's say, a $55 plan,
right,
your co-pays under the $55 plan will be usually a little bit less than 0. So why would somebody go into a $55 plan? Let's say, maybe they're accessing a lot of services.
yeah, they
And
need
that-
a lot more.
That copay, I'm willing to go ahead and pay the additional premium because the copays are going to work out better for me because that copay is less than over here, and so you do the numbers and it works out better that way. And maybe the $55 plan might have some additional dental that the 0 plan doesn't have, or may have additional vision that the 0 plan doesn't have. So just gonna.
You might have to pay in that to get maybe the dental and the vision,
Yeah.
and then.
But go
Do
ahead.
you still end up with, quite a bit of co-paying all the time then? Like-
No, the copays are, when you look at these plans, usually the copays difference, there's not a whole lot of difference between them.
Really?
So I tell my clients, let's do a comparison here. What's important to you in cost? The cost are really, a lot of time for people, it comes down to cost. What is my plan going to cost me for my premium, for my medications, doctor visits, etc. So quite often that's what will happen, is that we do a comparison and you'll find out, I don't really need to pay that extra premium.
And since they have this open enrollment every year, if you come to a place where, you're needing more attention for some reason at the doctor's or whatever, more appointments, maybe more medication or whatever it is, then that way they give you these options to, change your plan once a year so you can adapt, so
Exactly.
you're not stuck with something that doesn't gonna help you.
Absolutely. And the reason you do that is, we talked before, is medications, every plan has a drug formulary. Okay? That's a list of drugs they cover. They don't cover all the drugs that are.
They won't cover them all, that's
They
weird.
don't. Well, what they do, that's just how the system works. They'll have, Medicare requires these Medicare Advantage plans to cover a certain number of medications for each category of need. Example, insulins. There's a lot of insulins, but the companies don't cover all the insulins, they'll cover certain ones. Maybe one insulin is covered here on this plan, but not over here on this plan, but they have a different list of them. So that's why it's important to find out what plans cover your medications.
The other issue is what tiers they are on.
Wow.
So,
Yeah.
so one medication at one company might be in tier 1, so you pay the least, but at another company it might be a tier 4.
That's right. And
That's the other issue they have.
That's right, that's very true. There's 5 different levels of tiers. There's tier 1, 2, 3, 4, 5. There's preferred generics, preferred drug, brand names. And then the 5th one is kind of exotic drugs, very expensive. Now remember, medications under Part D is what you get at the pharmacy. There are medications for Part B, but those are administered in a clinical setting. So it's a little bit different. You're not getting that medication at the pharmacy, you're being administered in a hospital or a clinic. So there's two different ways, two different types of medications there, so don't want to get too confused on that. But, so did that answer your question?
Yeah, so the Part D would be like if you need something on a regular basis, a medication, then that would help you cover going to get your prescription
Right.
refilled.
Right.
Whereas if you're saying Part B would be when you're in a clinic or a hospital. So
Right.
if you go home from that and you needed a follow-up medication, then would that mean that you, at that point, you're stuck unless you're on the other D?
Well, you'll have Part D already, but your plan may not cover that medication.
Oh, wow.
We don't know. So what happens is the doctor gives you a script, you go to the pharmacy says, we don't cover that, calls the doctor and says, is there an alternative we can use?
Yeah.
That's in the formulary, so you don't have to pay $300 or whatever it might be for a Tier 3 medication. And those are the ones we're concerned about is Tier 3, 4, and 5. Those are the ones that are very expensive. So every year, you can be on a plan and you love your plan, it's working good for you, but the plan decided next year we're not going to cover this medication or this list of medications. That's important to know. So then we can do a review and find out, here's your other options. Let's find you another plan that covers all your meds and all your doctors. And let's do a comparison and see. And then you'll make a determination yourself of what you want to do.
It's
So,
complicated.
it is.
Because like, you just don't always know what's coming down the road, in your future, like, so I guess it's just like you really have to be proactive and ask a lot of questions.
I broke my crystal ball a couple of years ago, so I wish I still had it, so I can tell people what's going to happen in the future, but we don't have that anymore. So
No.
the best thing we can do is do a review every year, just to make sure.
Yeah, I see.
So let me ask you, now you're my class here, my students, so I'm going to ask you, what's the difference between, you can't answer, Neil knows too much. What is the difference between a co-payment and a co-insurance? Okay. Co-payment is a predictable cost. You go to your doctor and you have a $10 copay. Or you're hospitalized and you have a $350 copay. Co-insurance is a percentage. So when you're evaluating plans, you want to find out what's important to me. Because co-insurance is going to be around 20%. That's Medicare, 80-20 split. But 20% of what we don't know. So on a lot of plans, when you're looking at them and you're doing a comparison, you're going to see some benefits are covered with a co-payment and some with a co-insurance. And that's good to understand when you're going in for outpatient surgery. It's not the fun subject to talk about, but colonoscopies. Okay, everybody gets a colonoscopy. Well, in the past, a lot of those colonoscopies you would be charged a co-insurance of 20%. So you're on the table and you're ready to have a colonoscopy, you don't even know what this is going to cost you. Plans over the last couple of years have really changed to where a lot of them are moving to co-payment now. So you know when you're having that colonoscopy or that outpatient surgery, you know it's going to cost you $295 because it's a predictable cost. So that's the difference between the two. Okay? You want to add on to that?
You got it covered.
Okay, good. Okay, another question. PPOs and HMOs, what's the difference there? Quiet. Anybody? Okay. An HMO is a network of doctors. Okay? Franciscan, multi-care, could be in the network of doctors. Each plan will have a network of doctors, let's say Franciscan and a lot of independents. Those are the doctors that you can see in that plan. An PPO has a network of doctors also, but you are allowed to go outside of that network of doctors to see a specialist, but you're going to pay perhaps up to 50% of the cost of that visit. So what I tell my clients is we're very fortunate to be in Pierce County. The networks are very huge. Many plans have Franciscan and multi-care in them.
Oh, cool.
So my recommendation is always, let's just make sure all your doctors are in the network, so you don't have to go outside and pay that 50%. Now, there may be a situation where I've had clients say, you know, I really want to have Seattle Cancer Care Alliance. I have history of cancer in my family. Seattle Cancer Care Alliance is not available in the HMO, in the network, so I want to go ahead and go with the PPO. That's fine, we can do that. That's where the discussions and questions and all of those conversations come before you make a decision, so that you know exactly what your options are. However, if you want Cancer Care Alliance, they are in some networks. But do the rest of your doctors in that plan's network and all your medications covered? We don't know. So these are the things we have to kind of juggle to make sure that we can narrow down those 50 plus plans to the 4 or 5 or 6 that really work for you. Compare them, ask questions, answer questions, and go into more details. So, maximum out of pocket. That's pretty basic, right? What's that going to, that's the most that you're going to pay out of your back pocket. And every plan has a different maximum out of pocket. They're around $6,000 a year. Everyone's a little bit different. Let's use 6,000. I'm good on round numbers. So, the one thing, what that is, it's a protection for you. Maximum out of pocket is the total amount that you're responsible for medical services, not prescriptions, medical services throughout the year. Should you ever meet that, you don't pay anything for the rest of the year. Less than 2% of people hit that maximum out of pocket. Why? What's the one cost people are most concerned about? Medical. Maybe hospitalization. I'm in a car accident, I'm in the hospital for 30 days. Oh my God, what's that going to cost me? Well, on Medicare Advantage plans, there is a set amount, it's a copayment for what your cost is when you go to the hospital. Round figure. Let's say $400 a night. But you're responsible for 5 nights. So if you're in the hospital for 5 nights, that's $2,000. If you're in the hospital for 6 nights, it's $2,000. If you're in a hospital for 3 months, it's $2,000. You could be in the whole year, your cost is $2,000. That $2,000 gets applied to your maximum out of pocket. So now you had $6,000, you've got $2,000 applied to it, you have $4,000 more that you would have to pay to get out, to not have any coverage, not have any cost beyond that maximum out of pocket. So you would have to go back to the hospital maybe multiple times. It does happen. Or maybe you have a lot of chemotherapy, or you've got a lot of physical therapy, or some other service that is ongoing that can really add up. I have some clients that are doing physical therapy, and they have PT 2 or 3 times a week at $40 a pop. That adds up pretty quick. So it's the maximum out of pocket is a protection. People think that's a deductible. There are no deductibles on Medicare Advantage plans for medical services. Okay, you go to the hospital, and it's a $400 copay, that's what you pay. There's no deductible first. And as we know, if you've ever had an individual plan, or you've had a group plan, employer plan, a lot of times there's a high deductible in there. I just got off the phone, I was on the way over, I had a client call me, not a client, but a prospective client, and he said, he was calling asking questions, and he said, he goes, I'm turning 65 in January, And I said, well, what plan are you on right now? He goes, employer plan. And I said, well, sometimes it's better to stay on your employer plan than just go to Medicare. I won't go into the weeds of why, but sometimes the cost of medications are less expensive on an employer plan. And I said, what's your deductible? He goes, $6,000. Well, he has to pay $6,000 before his copay start. So there is no deductible on Medicare Advantage plans is the point. Any questions about this?
So, like, say if you have to go to the hospital, but since they have a maximum out of pocket, no matter whether it was a long stay or a shorter one, you would pay up to the 6,000? Or how does that really work with the hospital?
The 6,000, that would be for all of your medical services throughout the year.
The whole year?
Right.
So you just keep paying your co-pays, in other words, when you go to do whatever?
Mm-hmm.
And then if you had a whole bunch of stuff going on that year, that way you'd only go up to 6,000, it would be like 100,000, 200,000 or whatever. So, and so that's to protect people from going bankrupt, basically.
Yeah, no, that's right. That's very
Losing
true.
your home, maybe. Being out on the street with the homeless, that'd be fun.
It does happen. But it's difficult to reach that because it just depends on your situation, but you have an understanding now that if you have one long hospital stay, you're not going to reach your maximum out of pocket. You're going to, whatever that response. And that $400 a night for a hospital stay per night, that includes operations, anesthesiologist, room and board, nursing care, any medications that are administered, all of that's included in that $400. So you have triple bypass, go in there. They're not going to charge you for the operation, they're not going to charge you for the anesthesiologist, all included in that $400. Okay, eligibility, must have Parts A and Part B, continue to pay your Part B premium. Not have end-stage renal disease, that has changed last year, right, Neil?
I know that.
Yeah, so people with end-stage renal disease, that's kidney failure. In the past, they weren't allowed to enroll into a Medicare Advantage plan. They could stay on original Medicare and get coverage, but not Medicare Advantage plan. That's changed this year. So people that are in ESRD, we call them end-stage renal disease, will have the ability to enroll into a Medicare Advantage plan. That's a good thing because dealing with that disease is terrible and very expensive. You must have a valid enrollment period. Well, that's right now we're in it's annual enrollment. In your situation, it's going to be initial enrollment because you're turning 65. But then there's also a special enrollment. Or open enrollment. So you have to have a valid enrollment period. You just can't make a plan change anytime during the year. And if you're on Medicare and you go into next year, of course you do have from January to March to make that one plan change. But after that, if you wanted to make a plan change, you can't do it until the next period.
But as long as you're, like if you're new, like I'm going to be new, as long as you do it, start applying and getting it figured out 3 months before your birthday is and it said 3 months after too, right? Somewhere in there you have to figure it out, right?
Best to do it the 3 months before.
Best just to get it going and get it all set up.
Get your A and B, your application in for your Part A and Part B. Because really what you want to do is have your A and B, either have your Medicare card sent to you or have it at least in the system. When I tell people in the system, that's what matters. We need that. You don't need to show your card. We just need to make sure you're in there and you have a Medicare number. If you have a Medicare number, we're good to go. Now we can go ahead and enroll you into a plan. But in the meantime, while you're waiting for that, I want my clients to give me your doctors and your medications, so I can start doing do my research to do my plan comparisons for you to send to you, and say here's your options. Your doctor's meds are covered. Here's some options for you. Take a look through it. You're going to have some questions, and we'll go through it together afterwards to make sure you know exactly the differences. And then when you're when you're in the system with A and B and you have a Medicare number, now we can enroll you. I don't want to do it after you've got your number. You know, let's get it done now. And I don't like to procrastinate, put things off. So that's kind of the process that we use.
Now, I wasn't here at the very beginning, where are you based out of? Where do you work from?
I live on Fox Island,
Uh-huh.
so I'm local.
Oh, okay.
Yeah, and I'm available year round.
All right.
I have about 600 clients, so
Wow.
they keep me pretty busy.
So you charge a big fee for
No,
that?
there's no fee.
There's no fee, you're just like, you work for like Medicare helping people?
No, I don't work for Medicare. I'm an independent. I'm licensed with the state, and I am licensed with every carrier, not just one or two companies.
Wow.
It takes me about 3 weeks of 8 hours a day every year to get all my recertifications done for Medicare. Because you do that, you know, that's usually done around August. Yeah, it's, you know, it is what it is. But if I just contract with a couple of companies, I'm not servicing my clients. What about all these other companies out here? You know, we need to make sure, you know, you have the ability to enroll in any plan. And it's a little bit more work on my part, but, you know, to me, it makes sense to do that because I know I am offering my client their best options. Otherwise, if I had two companies, I'm selling.
Yeah.
I'm trying to sell you on these two plans. I don't want to do that. I want to say, hey, I'm going to educate you on what your options are, and you're going to determine yourself.
Oh, that's really cool. That's really great.
Yeah, so I'm compensated by the insurance companies, whatever carrier it is. I don't have a dog in the fight. I don't care what plan you enroll into, other than the plan that you want to enroll in, what you feel is best for you. And I have clients tell me, Bill, well, what plan should I enroll into? I said, I'm not going to tell you that. After we've gone through everything, I'm not going to tell you that. Let's go through it again. You're going to make the decision. I want you to be confident. I have an idea which one I would suggest. And if you want me to say, this is the one you need to really take a look at because of this, that, and the other thing, and we'll do that in our comparisons. But you're going to make the final decision.
That's good.
Yeah, I don't know why somebody would not want to have a broker or an agent. It doesn't cost you anything. You got them year round. And if you have one right now, use them. If you're on Medicare right now and you have an agent, use them. That's what they're there for. That's why we get paid. But, you know, in every industry, there's different levels of service, right?
Bill?
Yeah.
Will you have time to cover the Medicare supplements, Medigap?
Yeah.
Okay.
Yeah, we're going to do that.
Okay.
So with HMOs, you have referrals. Your primary care physician gives you a referral to see a specialist. You need to see an oncologist. The doctor will give you a referral to that oncologist, and then you can go ahead and see, and then the plan knows. And what nice thing about referrals, some people say, I don't like a referral, I just want to go to the specialist. Well, sometimes you don't even have to go to the office to get your referral. You can call your primary care physician and they'll give you a referral. But usually in a situation like oncology, it'd probably be something the doctor says, yeah, we need to go ahead and do this. We'll go ahead and get you a referral. But the nice thing about that is now with a referral, that doctor knows that you're going to an oncologist or a specialist, and that doctor is going to get those reports back. So when you see your primary care physician, the next time he or she will have all that information. So when moving forward and what you need to do is it's all in the open. The doctor knows exactly what the report was, what the results were of your test. Prior authorizations is something that for certain services you're required to have. Let's say you want to have, your doctor says, you need an MRI. Okay, well, the plan, an MRI can cost $7,000. So the plan, I mean, the company, your Medicare Advantage plan is going to say, no, hold on a second. You just can't go get an MRI unless we are convinced that you need one. Well, at that point, the doctor sends in medical records that justify that MRI and that cost. Because that MRI might cost you $300, but the plan's got to pick up the rest. So they're going to want to make sure that, you really need to have it. So prior authorizations is just an approval in advance for certain services. Okay, Medicare Advantage HMO plans. Physicians do not accept all Medicare Advantage plans. We know that, right? Your doctor has United Healthcare. Maybe another one also, but there's 10 or 12 companies out there, so doctors don't contract with all of them. So we need to make sure that your doctors accept the plan that you want. Every prescription drug plan has a different drug formulary, which means a drug covered by one plan may not be covered by another. Formulary is a list of medications that the plans cover. Every plan has a different drug formulary. Some prescription drug plans will have deductibles where other prescription drug plans don't. Well, right now for this next year, the deductible is going to be $445. That means that on certain medications, on certain plans, you may have to meet a deductible of $445 before your co-pays start on your medications. Those are normally going to be for tiers 3, 4, and 5 medications. However, there are some plans that don't have a deductible on any of the tiers. So you don't have to pay that deductible. Now, the deductible does not have to be $445. It could be $100. It's up to the plan to determine what they want to do with their plans. That's why they're all so different. So one might have $100, some may not have a deductible at all, one might have $445. What I do when I do my comparisons for my clients is we want to find out what the premium of your plan is plus the cost of your medications. Because premiums can go from $7 a month up to $100 a month. Well, that's kind of important to know, right, when you're looking for your medications. So we're not just looking for the cost of your medication, but the premium as well, if there is one. Because that's going to be basically your cost for the year on your medications. And when we're talking about PDPs, these are standalone prescription drug plans. And Neil brought up a question here about supplements we're going to get into. But there's Medicare Advantage plans, as we know. We have A, B, and D prescription all-in-one plan. Supplement plans are a little bit different. And they don't include prescription drugs, so you have to purchase a prescription drug plan on the side. And that's when that premium and cost of medications is real important when we do our evaluation. Health club, every plan has a gym membership. There's different ones. There's Silver Sneakers, been around for a long time. There's Silver and Fit, and there's Active, Renew Active. And each company will have a different network, one of those three. Some people say, I'm going to go to the YMCA because I'm going there now and it's costing me $50 a month. I would like that on my plan. Well, okay, that's part of the discussion. That's not the most important thing. Let's make sure your medications and doctors are covered. And if you want the Y, and there's 3 plans here, this one you can go to the Y, this one you can't. Well, okay, here's your plan. So there's a lot of moving parts to all this. So it's kind of important to understand. But health club memberships are very important. People should really exercise. If you don't want to go to a health club, they all have in-home fitness kits. So you can order them, they're no cost, and they'll send them to you. Dental, vision, hearing benefits will vary on plans. Every year I get asked to sit down with the different carriers, and they ask, there was a few of us, not just me, but some of the agents, and they'll ask, well, how can we enhance our benefits? What didn't we do so good this past year? How can we better for next year? And it always was, for me, it was dental. Put dental in. Are you kidding me? You have to have good oral health to be a healthy person. It affects your overall health. And in the past, there wasn't a lot of dental. If there was, you had a premium you had to pay to get it. But a lot of these plans now will have dental coverage at no additional cost. So that's But every plan's a little bit different, right?
And I might add too, with dental, for example, the Advantage plan that I currently have, there's dental. However, there's a very limited number of dentists you can go to. So that's another variable.
So you have to find out who will even
Right.
take it, which is,
Yeah, and that's when you send me a list of your, doctors, your dentist should be in there as well. Because Neil's right, some plans will have a network of dentists that you have to, if you wanted this plan, yeah, you can go, but you have to go to these dentists. Some new ones coming out right now, wide open. You can go to any dentist you want to. You have to pay. You get your receipt. You get a reimbursement form. You send it to the company and they reimburse you. So there's, every plan again is a little bit different. But yeah, there are networks. And when as far as I'm concerned, a dentist is a doctor. It's a physician, I feel. So let's just make sure that your dentist, if there might be a specific plan over here that works good for you, but has a network of dentists and your dentist is in it, then you're good to go. But if your doctor isn't in that in that network, then we can look for another plan, or you change dentists. It depends on what's important to you. Okay, moving along. Neil, here we go. Neil jumped ahead a little bit. Great.
Well,
Supplements
looking
are...
at time, so that's why.
Are we running out of time?
10 minutes, it's 10 till 3 right now.
Okay, so Medicare supplement plans, I mentioned, a little bit different from Medicare Advantage. They cover hospitalization Part A and medical Part B. They don't have prescription drugs in them. They have to, you have to order a prescription drug plan on the side. Now, the nice thing about supplement plans that people like, there is no network of doctors. You can go to any physician in the country who accepts Medicare patients. So that gives you a lot more flexibility. However, the plans are a little pricier. They can go up to $200 a month. You have a deductible of $203, but after that you pay nothing for the rest of the year. So you need to go to the Mayo Clinic for some reason, and you're on a supplement plan, you're good to go. So just depends on what your needs are, right? What your finances are, what you're willing to pay. There's 10 different plans. And they're not offered in some states. They don't offer all the plans, and they all have the same benefits. So they're plan A through N. Plan N is a plan N is a plan N with every company. It's exactly the same. The only difference is how much you're paying, what's your premium from one company to another. Okay. Prescription, you have a supplement plan, you need a prescription drug plan. Well, these are standalone prescription drug plans, and you may have a penalty, a late enrollment penalty, if you don't have prescription drug coverage. This is my second seminar today, so I can't remember if I told you the story or not, but stop me if I have. I had a client, somebody called me, and he said, my buddy said to call, I need a prescription drug plan because I got prescribed a cholesterol pill. I said, okay, let me ask you a question. What plan are you on right now? He said, Medicare. And I said, okay, but do you have a Medicare plan that has prescriptions in it that isn't covering your medication? He said, no, all I have is Medicare. I don't have prescription drug. I said, why don't you have a prescription drug plan? He said, what do I need a prescription drug plan? I don't take medications until now. 72 years old. Healthy guy. A perfectly reasonable question to ask. Why do I need to pay for a premium for a plan if I don't have medications? Well, if you don't, then you get a penalty. So I had to tell him, I said, I hate to tell you this, but you're going to have a penalty. He said, why? What are you talking about? And I said, well, I explained it to him. It's 1% of the national average. And so, 7 years. The national average right now is $40 for a plan, so 1% is 40 cents every month. It adds up. So over 4 years, of course, back then premiums were less. So we calculated. He asked me, and I said, well, it's probably between $25 and $30 a month penalty is what you're going to have. He called Medicare and found out it was around $27.50. So he said, what do I do? And I said, well, Again, I'm not gonna tell you what to do, but here's your options. You do nothing, you got your Medicare card, you don't have prescription drug coverage, you can buy that cholesterol pill over the counter for $10 or whatever it is, not very expensive. Or you enroll into a Medicare Advantage plan and to get your medication, but now since you've enrolled into a prescription drug plan, you have a penalty, and it's going to be $27.50 for the rest of your life. So he said, I guess I could stay with what I have, but what's the downfall? And I said, well, what happens 5 years from now if you are diagnosed with COPD? And now you need to have an inhaler. Those could be $300 to $400 a month. If you don't have coverage, it's what you're going to pay. If you're on a plan, they're going to cost you around $45 a month. So he said, I think I'll just go ahead and eat the penalty every month. And he enrolled into a Medicare Advantage, but I feel more comfortable now. He understood, he was fine. So now he had good coverage. If something happens later on, at least he does have a drug plan. That hopefully the medication he gets prescribed is covered in that formulary. But if not, we just make the change next year. You have a monthly premium. You pay a portion of the drug cost, of course. Coverage varies by plan to plan. And plan designs must be equal or better than standard Medicare benefit designed by CMS. And I mentioned earlier, they have to have a certain amount of medications in their drug formulary. Part D prescription drugs, premiums start at $0 per month and could go up depending on the plan. I can tell you that the $0 per month and the prescription drugs will only be on Medicare Advantage plans. There are no standalones that are at $0 premium. They start at around $7 and go up. Included with some retirement plans, late enrolled. The reason we talk about this is if you're on an employer plan, I have actually done an evaluation for somebody and then I'm telling them you're better off staying with your employer plan. Really? Why? Well, because with Medicare we have what we call the donut hole or the gap where the cost of your medications go up. With employer plans, you don't have that. And the types of medications that he had warranted him to stay with the plan he was with as his retiree plan. Late enrollment penalties may be imposed, and veterans are exempted. Extra help. This is for people who say their income is around $1,500 a month or less. Extra help through Social Security will help pay for their medications. Dramatically help with their medications. So, somebody's in this situation, I hate that sometimes I don't like to ask people what their income is, but it's kind of important because if their medications are expensive, this makes a huge difference. And if you're on Medicaid, you also have extra help automatically. So we talked about the gap or the donut hole, and you have a deductible. This is the first stage. You have to meet your deductible if there is one. Initial coverage, this is complicated, but once you and the plan reach $4,430, that's for next year, then you fall into the donut hole. And to get out of the donut hole, you have to pay $7,050 out of your pocket. So when you're in the donut hole, you're going to be paying around 25% of the retail price of that medication. So if you're in the donut hole, the cost of your medications will go up. Once you pay $7,000 out of your pocket for medications, I do have clients that pay that. Multiple sclerosis medications, injections through the pharmacy could be $1,500 a shot. You've got a number of the other very expensive medications. I have clients, they know that they're going to hit that every year. It's really unfortunate, but they do. So they know. But once they hit that, they fall into catastrophic, then the cost of their medications go down to 5% or $3 to $9 for the medications. Common drug list terms, I'm going to go through this rather quickly because we're getting short on time. You've got your formulary. We talked about prior authorizations for some drugs. Quantity limits, opioid problems we have right now, that's why quantity limits, they may only give you a 30-day supply, they won't give you a 90-day supply on some meds. Step therapy, is when the doctor says, I'm prescribing you a tier 2 medication, but the plan says, you know what, we have a tier 1 medication, it's a lot less expensive for you, it seems to work well for our clients, our members. And so you can try that. If it doesn't work, you step up the tier 2 medication that was originally prescribed for you. Transition supply, we won't get into that, that's not necessary. Medicare coverage, so you've got original Medicare with A and B, and then you've got your option of going with a supplement plan and a prescription drug plan or Medicare Advantage. So those are your 3 options basically. Not too many people will stay with this for obvious reasons. So where do you go? Stay with the retiree union plan, you go with a supplement plan, or you go with Medicare Advantage. Education is the key to healthcare decisions. You must be confident in your decision. With so many Medicare plan options from which to choose, understanding how to compare the differences in costs, making sure you have the access to your doctors, and determining which plans cover all your meds at what cost is a difficult task. Understanding how to compare plans in order to make an educated decision on which plans best fit your individual healthcare needs and financial needs is the goal. If not researched properly, you run the risk of not being able to see your doctors or having access to the medications that are prescribed to you. So what's the best path? We want to budget your medical costs, travel, be able to go to any doctor anywhere, see a doctor or a specialist, co-pays, deductibles, referrals, that's important to you, and ensure to keep it, get it and keep it. What is the best path? Well, these are the different things you want to think about. Pay or lower premium using VA services. You like the network of doctors, and low income subsidy for Medicare if you're eligible. Retiree or union plan, ask questions. Are there co-pays or deductibles? Does it include a drug plan? If I opt out, can I go back? Most likely not. So it's an important decision to make. That's why I'll tell people before we get you off an employer plan, you have to make sure that that's the best situation for you. What are the costs? And does it include dental and vision? And of course, with union or retiree plans, they don't have a donut hole, so you're not subject to that. How do I make sure I enroll in the plan best fits my needs? Well, we went through all this, making sure your doctors and medications are all covered on your plan.
And I might want to add, if you're a certain zip code, area code, like I am in, it crosses over into Kitsap County. Right? So here in the Pierce County, you have choices of 50 plans. But across the county line, in Kitsap, you have fewer choices.
That's right. Very good point. Yeah, all these plans are based by county. And so why does Pierce County have so many plans? Because they have so many doctors, right? And so plans, they have to contract with so many doctors. Some plans can't contract in Kitsap County because they don't contract with enough physicians. You can't just say, yeah, I'm offering a plan in Kitsap County, but we've got 3 doctors. No, Medicare says you have to have a certain number of doctors to take care of your patients. Yes?
If you in Kitsap County, can you see a Pierce County doctor on some plans?
Yeah, if it's in the network, yes. Anywhere in the state. Yeah. And because some plans are in, 14 counties. And so you can go to Spokane if you need to. You need to go to UW and Seattle or, Cancer Care Alliance. As long as they're in the network, you can go anywhere outside of your county.
Kaiser's
Good question, though.
Kaiser's a good example, being cross county and across the state,
Yeah.
They're across the state, Kaiser.
pretty much.
Oh, cool.
Yeah. Okay, so we won't go through all this. What is recommended to research? List your doctors, medications, name your pharmacy. Now, there's 2 different types of pharmacies. There's preferred pharmacies and retail pharmacies, I think we mentioned. So you want to go to the preferred pharmacy. That's when you're going to get your best cost for your medications.
So if you prefer going to cost less, again, it's something to consider.
Yeah, exactly. Well, people love cost less. wonderful. But they're not a preferred pharmacy on all plans.
Correct.
So it's kind of important to know. But I will have some people who are going to cost less. I don't care. I love the people there. They treat me well. They're local. That's where I'm going. Cost me a little bit more, but I'm going anyway. That's fine. So questions? Let us help you with your unique situation. The decisions you will make will impact your health coverage for a long time. And that is the end of the presentation, the seminar. Any more questions? You have some great questions. I love this when people ask questions. Is there anything else that we haven't touched that you want to discuss?
Well, thank you. It's just so helpful to help sort out this.
Well, thank you.
It's
Yeah,
complicated. It's definitely a learning curve.
Yes.
It is. And the one thing is I just want to educate, I don't want to educate my clients on all of Medicare. I want you to educate you, once we made a decision on your plan, I'm going to educate you inside your plan too, of how that works. Next year could be a different plan. So, and if you have any questions throughout the year, I'm always available to answer questions to make sure you get through any issues you have. And many times we can resolve that ourselves. I know all the regional managers, and if I have a billing issue or something that's rather serious, take care of it for us. Don't go through customer service, give it to me, I'll send it up to them. And then if they need to escalate it up even further, they'll do that, and we get it done. And we have the this Pierce County have a lot of real good regional managers for all these different plans, and it's the relationship that really kind of helps out for me as well, because I do seminars for them. They ask me to do seminars for them specifically, I will. So we've got a good relationship, and that's kind of important for me to be able to get the information I need and get things resolved.
So how long have I known you, Bill? It goes back
5 years?
10 years.
10 years, has it been? That long? Could have been.
Because I've attended your seminars at the library, Pierce County Library, at St.
Yeah.
Anthony's.
Yeah.
Here.
Yeah, you find me somehow, you keep finding me.
Yeah.
I try to avoid you, Neil, but you always find me.
Well, it keeps you sharp. You have to stay sharp on this stuff.
Yeah, well, I'm getting older too, so we'll see how long I can do this. But as long as I can help my clients out, I'm going to continue to do this. There's no reason for me to quit. What am I going to do now? I'm so involved in doing this from day to day. I'm going to say, okay, what do I do now? You can only go to the gym, you can only play golf so many times, you can only this, regard gardening and that kind of thing. But I appreciate that. Thank you very much. I love this career very much.
That's not to take away from Bill's presentation and his knowledge. The alternate source for information on Medicare would be Sheba, and in my office there,
Which you are part of.
Which I'm part of. There's an 800 number. You can call the state insurance commissioner's office, and they refer you to a Sheba volunteer. There's another Sheba volunteer here on the Key Peninsula. And a good number of Sheba volunteers in Pierce County, so they can certainly help you as well. That's not to take away from Bill.
What you do is great. You can talk about how Medicare works and that type of thing, just like we're doing here. You just can't talk about specific plan information for different companies.
That's knowledge.
Yeah, that's where it ends right there. But no, Sheba is a wonderful organization. They do a phenomenal job, and I don't know where we'd be in this industry without people like Neil.
And here in Pierce County, it's Sound Outreach that's coordinating the Sheba volunteers here.
Well,
Okay.
we have a new community health center starting up the street, which you probably know about. But I read in the paper, our wonderful community paper, otherwise I'd be clueless, that it's coming from Tacoma, but it's geared towards helping, really helping people who need help. But I don't know how that works as far as Medicare or those kinds of.
So are you referring to Dr. Rose's office?
They're going, yeah, Dr. Rose, but then they're going to put it in up above where they used to have that bead company on the right-hand side.
There's one up where our.
Right before Shell, isn't it?
Yeah, right before the Shell. It's a different thing. Yeah.
Oh, okay.
Yeah.
have.
But anyway, that would be interesting to see if they're gonna kind of coordinate how they're gonna do the medical insurance side of that. That would be good to know, because it's right here on our.
You do need more physicians up here
Right,
in this
absolutely.
area.
Absolutely.
In clinics. Dr. Rose is wonderful. I have a lot of my clients with Dr. Rose. Yeah, you just have to find out if they do open up, then find out if they contract with Medicare.
Yeah, just
And what
that,
plans?
I guess.
Exactly.
Yeah, they should, because there's so many retired people out there, you know.
Yeah, exactly. Most likely they would. 96% of physicians are contracted with Medicare.
That's
four.
that's good then.
A little bit 4% do not. That's why we always want to make sure you're not that 4%.
And the second point is, will this physician or the primary care provider accept additional Medicare patients? If they're in an Advantage plan, I think it's a little different, but if you're in a
Oh,
supplement plan.
there's the discrepancy.
Yeah.
Well, there's a problem right now with the number of physicians we have in this country. And some of them are no longer accepting Medicare, they're retiring, whatever you're doing. But it's hard sometimes to find a primary care physician. When I enroll somebody in the plan, we have to have a primary care physician on that application. So you have to find one. Someone who's accepting patients. They call it an open panel. A closed panel means I just can't take any more patients. I'm on overload as it
Oh,
is.
yeah.
And that happens quite a bit right now. You'll find out that no, they're really not accepting any more patients. So if you find a good primary care physician, hold on. When you enroll into a plan, you have a primary care physician, you know, you can make that primary care physician or PCP change anytime during the year. So if you're not happy with your doctor in June, you can get a new primary care physician just as long as they're accepting new patients and they're in the network of your plan.
Oh,
So that's what some people will do, is they start doing a little research. So it can get a little tough to find somebody who's accepting new patients. So I'm glad to hear that there will be a new clinic coming in up here.
Yeah, yeah.
So anything else?
I apologize for the temporary exuberance out in the lobby.
What was that, Maura?
I apologize for the temporary exuberance out in the lobby.
Oh, that's fine.
We had a visitor.
That's
And
good.
very nice visitor, by the way.
That's great. This is a great place to have fun.
Yeah,
You know, that's just what this is all about anyway, right?
Right.
It's a wonderful place.
Oh, fun.
Well, all of the resources you have here, I've never seen a senior center have more resources than you have here, anywhere in the county. And I've been to all the senior centers.
Really?
Yeah, oh yeah. Yeah. And with help from Shiva and, you know,
Wow.
organizations like that, it's very unique here. You guys are real lucky to have this facility.
It's very needed.
Yeah, for
This is a
sure.
very needed community for that.
Well, it's a unique little community here, the Key Peninsula, isn't it? Or it's not, it's still considered the Key Peninsula?
Yeah.
Where's it start, where's it end? It goes all,
currently to the end.
To the end.
yeah, okay. So,
And to the kids that kind of line.
yeah. And, there's one thing that happens sometimes, I'll get a zip code from somebody that lives over here, but it'll ask me, is this KIPSAT or is it Pierce? Because it overlaps.
Yeah.
Is
There's a
it
line.
329, 98329?
Yeah.
Yeah. Yeah, it goes both kids. So you have to be a little careful because then I have to choose, you know, if I choose KidSat, well, that's the wrong choice. When I'm doing applications, this is what happens. Well, we need to make sure your plan is in the county that you actually reside. It's not where your P.O. box is, it's where you live.
Where you live.
Yeah, so you can't say, oh, I'd like to get a plan over this county, so I'll put a P.O. box over there. That's not going to work. Okay? Well, thanks for coming. I really appreciate it. I love the fact that people are being proactive with health questions and their Medicare needs and things like that, because it is very complicated and people will make mistakes if they try to do this on their own. Sometimes they can do it on their own and it's fine.
Not me.
But, you know, why not? Right?
Well, thank you, Bill.
Okay, thanks, Joe.
Thank you.
Thank you. Very complicated. I still, that's a lot